when you build your private practice, you damn well better know what your private life is going to look like. I mean, I like to ride motorcycles. I like fast cars. I've raced cars before. I built my life first and I built my practice around it. Never the other way. I think too many people, okay, this is my career and I can't do this and I can't do that. You're not going to be happy doing that for long. You're just not. So build your life first and then build your practice around it. And you can do it. You absolutely positively can do it.
Hey, it's Jesse Garza with Premier Leadership Podcast, the place where we have real conversations with real leaders. And today I'm happy to have as my guest Dr. John Hayes. Uh, John, he's founder of, make sure I get this right, is it South Shore Direct Care?
Yeah, South Shore Direct Primary Care and Neuromusculoskeletal Medicine.
Well, I'm happy to have you. Thanks for taking the time today to be on. How are you today?
I'm doing great. How about yourself, Jesse?
I'm doing good. Thank you. I'm really excited to get into what you're doing with South Shore Direct. Innovative stuff that you're doing there. But first, would you please share a little bit about yourself and your the journey and what led you to doing what you're doing today?
Yeah, I mean it's a little bit of a story too, so I'm happy to tell it. So I've actually been in healthcare since I was 20 years old. I started as an orderly back in the day in Milton Hospital, and that was before managed care and a lot of the stuff that's gone on in healthcare now. At the time, I was able to have an incredible training and education from the nursing and medical staff in my 20s, and that kind of spurred my path to go into healthcare. And at the time, had some coincidental things happen. I originally wanted to be a pathologist. I was convinced of that after working in the hospital for a couple of years. But I actually had a back injury myself, had a phenomenal encounter with a chiropractor who was really one of the only people that could help me. So instead of going the medical route, initially I went to chiropractic, mainly because I've always been interested in health since a little kid. My family was, organic gardening, plant-based Mediterranean type diets and that type of thing. So I had an interest in healthcare, but at the time, chiropractic resonated with me and it resonated with me for a while. Long story short is I ended up staying in chiropractic for over 30 years, a very successful career. I was a board certified chiropractic orthopedist, also had a master's degree in nutrition. And then about 18 years ago, my entire career took a turn. I actually got heavily involved in treating patients with peripheral neuropathy. I had a family member who was suicidal and she couldn't get any relief anywhere. And so I had seen neuropathy patients before in my practice. And that's another story too, because my practice was never a typical chiropractic practice. That's another story. But in any event, I had seen a lot of severely ill patients. But long story short, I developed treatment protocols to help patients like her, get quality for the remainder of her life, which she lived about, 8 or 10 years after I started to take care of her, most of the time comfortable until she passed. And that was really the path that I was seeing with a lot of these people that were seriously ill. I was able to help them when other people couldn't. And so people started to seek me out on what I was doing, developing a medical device with my brother, was a medical device manufacturer or engineer, I should say. Long story short, developed some nutrition protocols. Heavily into this, right around 2008 or so, we started to license neuropathy DRT treatment centers around the country. And at that time, actually around the world, we had like 50 treatment centers where we were actually treating peripheral neuropathy. And then it just got so crazy for me, and the patients were getting sicker and sicker and sicker. And I was working with a bunch of physicians. And finally, one day, a physician said, "Dude, you just have to go back to school." So, unbelievably, I went back to school. I went to medical school and I completed medical school. And then I just finished residency a little over 2 years ago.
Wow.
So a total game change. Now, along this path, I was fortunate enough because from very, very early on, I knew I wanted to be independent. I'm not somebody who would do well working for somebody else. Never have been because I'm really independent. And I really like that about my previous profession. So when I got into medical school, I was introduced to direct primary care, what it is, and I really liked the concept incredibly to write for the journal Authentic Medicine. And I still do that. I wrote through medical school, through residency, and I still write for them as well, which basically is one of the biggest platforms out there for physicians and other healthcare professionals that want to learn much more about direct primary care.
That's quite the story. I like that you kind of been off the beaten path, done things a little differently, that's we'd love to feature on the show for sure. I see that you maybe coined the phrase lifestyle medicine. Could you tell us a little bit more
Yeah,
about
so I did not coin that phrase. So lifestyle medicine now is actually part of certain residency programs. Now, when I started residency in 2020, at that time, I think there were only 7 or 8 programs in the entire country. Residency is for family medicine is the 3-year path that we take after medical school, which is clinical contact, the entire time clinical training, a lot of inpatient, a lot of outpatient, really, really wide variety. But I was so fortunate to where I matched to residency that I was able to do family medicine, an incredible program. In fact, a good part of my residency was at one of the number 1 teaching hospitals in the entire country. And then along that entire 3 years, I also did lifestyle medicine. And that's a phenomenal journey. Whereas physicians, we actually learn everything about lifestyle and how to help patients improve their lifestyle and make that a big focus, not only for their health, but also when we can integrate it into disease care too. So that's lifestyle medicine. It's becoming more and more. I don't know how many programs there are now, but again, a phenomenal, phenomenal experience for me as a physician. Yeah, definitely different path. I mean, we did everything. We did everything from in some of the summer times going with a lifestyle medicine facility that was actually distributing local grown fruits and vegetables to the community. Also, we actually spent time in the kitchen learning how to prepare foods. And no other physicians do that. So it was incredible. It was really a mind blowing experience in a good way. Yeah.
that? Sounds
Yeah.
amazing, and I think
It
there
was
should be
amazing.
more of that.
There should be. There should be, and hopefully there will be.
Yes, indeed. What would you say is the thing that sets your practice apart from others? You
Well,
touched on a little bit.
it's obviously my clinical background because I have so much clinical experience, and I think it's important to note that, when I graduated from chiropractic college, because of my previous training, I was very, very medically oriented. And the chiropractic college I went to at the time, known as National College, was a phenomenal education for me. I had most of the faculty there were also co-faculty at medical schools. So the medical training was great and always had kind of a more medical bent than a philosophical chiropractic bent, although I thoroughly realized how important musculoskeletal health is and manual therapy and all that. But when I graduated and I started to practice, I connected with a local medical center, unbelievably, right near me. And they kind of opened their doors wide and said, "Look, we have x rays here. We have a bunch of consulting physicians, whatever you need, how we can help you." They were just great. And so I got more medical referrals. And back in the day, there was no pain management. There was very, very little postoperative care for musculoskeletal conditions. So I did a lot of non-invasive pain management. And I also did uh, a lot of pre-op and post-op patients, a lot of referrals from neurosurgeons in particular. So my practice was just like, my level of patience was higher than I think many chiropractors were used to. So that's been part of my path. And that's one of the reasons that, for me, it was a natural jump to, finally pull the trigger and go back to school.
Very nice, very nice. What would you say the principles that guide your leadership style?
I mean, it's independence. You have to have guts. You just do, because you know it very well from your background. You have to have guts and you cannot quit. When you set a goal, you're going to get whacked so many times. So many times. Before I landed residency, I was told so many times, "You're too old. You went to this school. Oh, you already have this career. You can't do this. You can't do that." And then finally, everything came together and boom. But it was literally years of just struggling, started was a struggle for sure, but just staying with it. You make a goal and you stick to it till you accomplish it, and you move forward. That's really the key. And you know that for sure from being in the Navy. I don't think a lot of physicians I don't think fully understand that, which is one of the reasons we don't have more independent physicians. And I think that's honestly, I want to say it's a disgrace actually, because right now there's over 1 million physicians in this country, and I think there's less than 300,000 of us that are fully independent.
Yeah,
Yeah.
sure.
Yeah. Talk about corporate equity takeovers. That's what's happened in healthcare. For sure. And, so it leads to a lot of physicians are very frustrated, very, very frustrated, which is why, now I do a lot of consulting, much as I did back when I was training patients and physicians in neuropathy care. I do a lot of consulting for physicians and physical therapists in particular, and other healthcare professionals, now chiropractors, acupuncturists, etc., who share my vision, want to be, fully independent on their own terms, but also do things to help patients in the highest ways possible without constraints. Nobody over me saying, "Oh, you can't do that for this person. Oh, you can't do that," or "That insurance won't cover this. You can't do that." We have none of that in direct care. So direct care is a one-on-one relationship with the patient, their family, and the community that we do what patients need. That's it. There's nobody, breathing down my neck. There's nobody saying, "Oh, Dr. Hayes, you have to see 35 patients today. And oh, by the way, you only can ask for you can only handle one complaint to this. You have to more than one complaint. You have to tell them to book another visit." Oh, when's that other visit? Oh, I don't know, 6 to 9 months. Or the other one I see a lot, Jesse, is patients belong to a primary care practice and they can't see a physician. They're not run by physicians largely anymore. And the other one that really kicks me is that patients join these practices that are, funded by insurance and that type of thing, and they have a health issue and they're told, "Oh, the doctor's too busy to see you. Have to go to urgent care." What?
Mhm.
So that's kind of what medicine's become. And in direct care, it's not. In direct care, it's the exact opposite.
Oh, that's great. That sounds like there could be relief because I know a lot of providers are struggling with that balance, finding that balance.
And there will be a relief. Finally, the federal government is waking up to direct care too, and it's going to be way, way easier after the first of this year for patients to use HSA's healthcare spending accounts and flexible spending accounts to pay for direct care benefits. And some other coexisting in the system type of rules. Like there are proposals now. I don't know if it's law, but there are proposals to have patients. So if you're paying 197 a month for a direct care practice membership, that should count towards your deductible because it's healthcare. So you can't get whacked two separate ways by your insurance carrier. So that type of stuff, it's going to happen. And what is also going to happen is there are going to be differently funded insurance plans that are going to dovetail very, very nicely with direct care. Some states are much easier to work with than others.
Great, great. You did touch on some of your the challenges that obviously everyone's gonna encounter along the way. What would you say was the one thing that you just really weren't expecting, didn't go quite the way you had planned?
For me, it would be not matching to a couple of residency programs that I pretty much thought I had a sure seat in. That was one of the most challenging things, probably the most challenging thing. But
How
it
did you
actually
overcome it?
turned out for the best because a year later I matched to, my dream program and actually ended up doing, like I said, a good part of my residency in the number one teaching hospital in the country. How do you beat that? So
Yeah,
it is all from sticking with it. You just not giving up.
that's key. Very,
It is.
very
It
key.
absolutely is.
So let's shift gears a little bit, and I'd like to know, hear what your take is on what we see. It's really big in the news these days, and everybody's talking about it is AI. How do you see that impacting your practice and the field in general?
You know what? So I was very, very fortunate to be introduced to AI. I've always been an extreme techie. I mean, back in the day, remember MS-DOS at a gigantic computer? Back in, I think, 2006, when electronic medical records first came out, I was actually asked, pardon me, asked to teach it to other physicians and healthcare professionals. So I did. I actually was teaching people how to use EMR because I had been tech savvy all the way through. So I got introduced to AI about 3 or 4 years ago now, and I've been using it, but I'm using it more and more now. It's a phenomenal tool. I mean, obviously, it can be very dangerous, I think, in the wrong hands, but it's an incredible tool when you learn how to use it. It's mind blowing, actually, especially when it comes to research. Now there are very, very good AI tools for medicine as well. Not that they're making decisions, but, so previously going to the library to research something or going through Harrison's textbook of internal medicine, which is like this many pages to look something up. Now you can go to a good medical AI and boom, you literally have answers within minutes. And it's helped me greatly. It's helped me with some potential patient issues, potential medication interactions that are dangerous, diagnostic options, interpretation of certain higher level diagnostic tests when a physician has an opinion that varies from another physician. Just learning to use those tools has been a game changer for me. I think a lot of people are kind of scared to embrace it, but it's something else that I really think you just should embrace. It's part of our world and it's going to be moving forward. So I'm huge on it. And also with regard to our social media, we use AI now for some of our social media creation and editing. So I'm big, big fan.
That's I'm glad to hear that. Those are great points, and you're right. It's kind of similar to like when computers came on, the internet. Like yeah,
Exactly.
you're a little apprehensive, but
Sure.
if you embrace it, you can use it to
Yeah.
leverage.
And you just spend the time to learn it because one of my favorite AI nows is actually linked into one of the medical apps and websites I use on a daily basis. So I can look up everything there, medication interactions, search articles, that type of thing. And if I want an AI interpretation or AI addition, I get it right there. That's a game changer. Talk about saving a ton of time. And yeah, I believe it's going to save a lot of lives if it's used properly.
Yeah, I would agree with you 100%. What are some what are some short-term goals? Like, where do you see you practice in 3 months to 12 months from now?
So I'm getting at the point. I'm about 2 years into direct primary care, and in direct primary care, we take a limited patient panel, and probably about two-thirds of the way of the number of private practice patients I'm going to take. So I'd like to bring another doctor into my practice. Yeah, bring another doctor in the practice for sure. Yep.
Definitely expanding, looking to expand.
Absolutely. Yep. Absolutely. Because I love what I do. It's a just a fantastic way to help patients. And because of my background, a lot of times you see patients that may be sicker than they would be in a more average type of primary care practice, but that's fine. That's what I like to do. It's challenging and that's what I like.
Sounds like you're on the right path.
Trying to keep that way.
Yes. What advice would you give anybody, any providers, any physicians looking to follow in your footsteps and open up a similar practice?
Honestly, I would say up your game, really up your game, much, much higher than you ever thought. I'm a huge fan of, many, many business leaders out there. Grant Cardone is one of my favorite. And the whole 10x concept of you have a goal, you think the goal is okay, well, multiply times two, for that times 10 rather than times two. Every goal you set, multiply it times 10 and shoot for that. It's a game changer. It's a game changer. But that's what it takes to be satisfied and to be happy. In my book, it's not the same for everybody else. Everybody has different goals. So I think the biggest thing, and I've told physicians and healthcare professionals this forever. When you build your private practice, you damn well better know what your private life is going to look like. I mean, I like to ride motorcycles. I like fast cars. I've raced cars before. I built my life first and I built my practice around it. Never the other way. I think too many people, okay, this is my career and I can't do this and I can't do that. You're not going to be happy doing that for long. You're just not. So build your life first and then build your practice around it. And you can do it. You absolutely positively can do it.
Yeah, those are very valuable points there that you mentioned. I'm curious, and I love Grant Cardone too. That you got to take massive action, build that momentum.
For
What
sure.
would what would your response be to somebody who said, I need my work life balance. I'm not sure, that I don't want to be
It's a
stressed
choice.
out.
It's a choice. Do what you want to do. This is in the direct primary care practice. I'm only working 4 days a week. And of course, I've got some prescription to place for patients and, maybe a virtual call or two, but in office, I'm there in business like 12 hours, 4 days in a row. And that works for me now. I live locally to my office. When I went to medical school, I moved my previous office very close to my home. So I don't have a lot of travel. And it's very easy for me to get back and forth, not a lot of travel time. Plus, it's very convenient for emergency patients and that type of thing. And I just had, this is what I like to do. I like to play guitar, as you can see. I like my downtime. But when I have a big goal, I'll work my ass off, pardon my language, until that goal is accomplished and the next one's, lined up.
I really love that. Basically, it sounds like you built the practice, you designed it the way you want it to be, your practice and your life
Exactly.
by design.
Yeah. And I was very, very fortunate to be exposed to direct care in medical school because I knew, when I went into residency, I went in with a very, very open mind. I said, okay, so if I'm offered a really good job at one of these very, very high level institutions, would I take it? I said to my wife, I said, I'm going in with a completely open mind. Well, after working in the system, and I really was I trained in a phenomenal, phenomenal institution and group of hospitals. but it's just not for me. Like I said, I'm just so independent that direct care is the way I want to go.
Nice, nice. And that's what this show is all about. So where can people find you, John?
So the best way to reach me really is my website for professionals is perfectpracticeweb.com. Yep. A lot of information there. You'll see a little bit more about what we do, what our career path is, some of the opportunities we help create for physicians and a lot of different healthcare professionals now.
Okay, perfect. Yeah, people will be able to find that in the show notes. Well, it's that brings us to the end of our conversation. I really appreciate having you, John. Everybody, that Dr. John Hayes with South Shore Direct Primary Care, and wish you absolute success and best in all that you're doing.
Thank you. And you as well, Jesse. Thanks for having me.
Thank you.
All right. Take care.
Take care.